Hi, I'm Michelle Turner from Early Intervention TV and MovementLesson.com. I'm here to discuss with you today autism. I believe that there are two forms of autism, a genetic-based autism and then the regression-based autism that you would see from trauma to the system, like vaccines and other things that could happen possibly to the child or prolonged sickness. So with early autism, a genetic-based autism, you might have had a cousin or nephew or something in the family that it's showing up, maybe a parent in your child. Now, the thing is here, I'm not looking for the diagnosis. There's no reasons why we need to diagnose, let's say, a 3 or 6 months old child, a year-old child. And I know a lot of people are really feared off that. I don't want to have my child have the diagnosis, I'm not sure. This is about early intervention. And I truly believe that if you see warning signs, let's take those warning signs and turning it into a positive. And is there a way that we can work with the child and get after those so they're no longer a warning, that they become a more happy functioning what's going on? So one of the things that you want to look for in a small child is they're just a typical rolling over. Now I have a video out already about what rolling over should look like. If your child is just not rolling over on time or not rolling over properly, that's one of the signs. It means they're not organizing their back just properly, and they're just not figuring things out. And if they're not figuring out just a simple rollover, then, that might be cause for concern. And you don't want to delay the rolling over because that then sets up crawling and so forth. So you need to really get in there, talk to someone like me, an nail practitioner, to see about a well baby checkup and try and get in where we can look at to see if maybe there isn't something else going on besides the rolling over, how the child holds their head up, etc. The second is not recognizing faces. And I'm not saying that the child's going to sit there and say, oh, Mom, what you doing? But that moms know that recognition that happens, that they look to you for that conversation, that coo, or they go to daddy, and where, again, that eye contact's just not happening. And of course they're going to have times where they're tired, they don't feel well, and that's not going to happen, so you can't look at it at a daily basis, but I'm talking about in general. Not responding to babble, and babble I mean when we have a young child, we start realizing that they like to mimic us. And we make all these wonderful sounds and noises that come out of our old age faces and at the baby, and the baby starts to mimic. At first it'll just be a tongue back and forth, and you'll start to see again that conversation start to go on, that they're mimicking you, that I can stick my tongue out too, or I can, and eventually it leads to a higher conversations where you say with baby, where's my nose, where's my ear? So that's not going to happen. Lack of name recognition. Now, typically baby's not going to notice their names, usually around the 8th month level. But still, if you're combining the things of not recognizing faces and so forth, where you say, where's my sweetheart? They should at least want to turn to where the voice is coming from. So when you're not seeing that sort of distance look in a child, when they're kind of just looking off like this, and again, that's a different look than, oh, what's brother doing, what's a dog doing, what's, if they get distracted, that's okay, but take it all into the overall of how your child's looking and responding. And then also the cranky or the fussy. People start looking at this like the colic is going on forever. What they're not realizing is a lot of kids with autism have a sensory problem. And by this I mean, it could be the tag, it could be just because they're not wearing cotton, it's polyester. What I like to suggest too with people, if they're not sure that all of these things are going on, is to keep a diary. Was the child fine until they got their feedings? Then they fussed. Well, then that's maybe something you discuss with their doctor because it has to do with their stomach. But just because they're cranky, they might not like the blanket in the car seat. They might not like, you're not realizing that these sensory things are coming up. And if it is sensory based, you'll tend to see that arching where they're like they don't want it to be touched, or they kind of put their hands up. It's almost like I'm being really violated. And these are just things to look forward to. So those are 5 simples you want to look forward to. rolling over, if your child is not recognizing faces, not responding to babble, not having the name recognition, and again, not specifically to their name, Billy, how are you, what's going on, but that mommy type and daddy, there should be enough voices in your child's life that they're starting to respond to, and that the cranky or the fussy. Always talk to your pediatrician first to make sure to rule out any kind of medical things. Again, cranky or fussy especially. It could be your child has allergies, food allergies that you're not recognizing, or another person that you want to talk to is the ophthalmologist. Very overlooked profession. Checking out your child's eyes. We do hearing tests and so forth. I know some doctors, pediatricians, do a vision test. I really recommend going not to an optometrist, but specifically a pediatric ophthalmologist, where they're used to developmental problems. A lot of people don't even realize that they think their child has autism, and they actually have visual problems that mimic autism and so forth. So you want to make sure the eyes are really on track at an early age, and we'll start showing you more things to look for with vision as a child with early intervention TV. But for now, right now, we're looking at autism.